All right.
Oh, now I can hear me. Good morning. My name's Steve Cranefield, and so I'm from New Zealand. So for those that don't know where that is, if you map of the world, know where Australia is, then New Zealand's a little one off to the right. So I guess the unique thing about New Zealand is that we're seasonal farming and pasture-based. So when I talk about Prototheca, just need to keep that in mind as we go through. So I'm just going to start to talk about first a little bit about Prototheca. So it's an algae. It's all around the world, and there's the two common strains which we have in New Zealand and most likely in your home country. Causes both clinical and subclinical mastitis, and the source of infection, water, effluent and fecal spread. How is it transmitted? Basically, intermittently in the milk of infected cows, spread cow to cow during lactation. It can survive the dry period and appear in the colostrum at the next parturition or calving, and calves fed contaminated milk may discharge Prototheca in their faeces. So when we're looking at Prototheca problems, it tends to be obviously mud, and Peter's talk this morning focused a lot about the environmental influence of muddy environments and the importance of poor teat disinfection, and also hyperkeratosis or teat end damage is a predisposing factor as well. So when I run through these case studies, we actually couldn't find the source of where these cows become infected. Infusing or poor teat disinfection while we're putting in dry cow in our seasonal system where we're putting in whole herd dry cow, that has been seen as a risk factor, and it's happened in some herds, but we couldn't pinpoint it in these cases. So how do we diagnose Prototheca? First of all, it doesn't survive freezing. So a lot of our milk samples in New Zealand are taken on by the farmer and frozen, and then presented to the laboratory in bulk. So if we do that, then we can potentially miss it. So we need to focus on getting fresh samples. It grows on blood agar after 48 hours and up to 96. And we differentiate it by microscopy, so taking colonies off the plate and putting them under a microscope. And it has these, I don't know if a passion fruit is a common fruit in all of the world, but I describe it as this kind of cut passion fruit appearance under a microscope, so it's very diagnostic. And you can get selective medium, so isolation medium if you need to, but the standard culture and microscopy is sufficient. I guess one of the tricks with Prototheca is that it's intermittent shedding. So when we looked at these case studies, we had to decide, how reliable is the milk culture. And so this paper by Rossler et al. In 2003, when they had 61 known Prototheca mastitis cases, 70% of them were continuously shedding, 5% intermittently, and 18% remained culture negative. So it's not a perfect test, but it's what we had available. So the unique situation we ended up in 2016-17 season, we had two herds which coincidentally, they were completely unrelated herds, got infections with Prototheca at a high level, which we'll see in a moment. One herd had the option of testing and culling immediately, which is, I guess, where most of your herds, that's what you would do if you find Prototheca in small numbers of cows. But that was not the case in the other herd for economic reasons, which I'll show you. So when we looked at the management options for these two farms, we had to consider, yes, it's an intermittent shedding bug. We have some limitations in milk culture. Not all cell count, we don't always get a cell count rise, and so our RMT or CMT may not pick it up. And if we keep cows on the farm that are positive for Prototheca, what's the risk of spread both through milk and fecal shedding? And finally, I guess the biggest driver in this was the farmer's stress and the economics for the farmer. So this is the first herd. They had 1,500 cows, which is a larger herd in New Zealand. We average around 450. An owner-manager, so the owner could make all the decisions. This herd had a high bulk milk somatic cell count, and getting back to the importance of teat end condition, a lot of hyperkeratosis and dry and dirty teat skin. So in that first year, there were 22 out of 30 samples positive for Prototheca. So given that incidence, we then took upon testing every cow as they calved down. So this was first diagnosed at calving time. As I said, it's seasonal calving, so we pretty much all our cows start calving about mid-July through to end of August. And we took over 1,700 milk samples, and 462 cows were positive for Prototheca. So all of those cows were culled immediately as soon as they were diagnosed. And then through the season in that herd, we tested some low-producing cows and some high somatic cell counts cows just to do some screening. And at the end of that season, we tested 300 cows just at random to see whether we still had any Prototheca, and all of them were clear. So that's a picture there of the bulk milk somatic cell count. So this is the preceding years before this testing was done, and in the blue line we've got the bulk milk somatic cell count after all those cows were taken out. So I guess you could argue that's probably the ideal scenario to cull the cows early, but herd 2 was quite different. So this is a 700 cow farm, that's the farm dairy there. We have a share milker system in New Zealand, so that means on some farms a share milker is someone who owns the cows and milks the cows and gets half of the revenue, and the land is owned by someone else who gets the other half of the revenue. So the economics are quite different for someone in this situation. So initially they had a lot of recurring clinicals on this farm, and again a lot of hyperkeratosis. So similarly, we did initial screening in this farm because of the high clinical rate, and found quite a lot of Prototheca in the first samples. So the decision was made on this farm to do the CMT test on all positive cows as they calved, because they were still calving down as we were going through this. We tested all the cows in the colostrum herd as they calved, and the milking cows we did whole herd CMT testing in September, November and January. And then at each herd test, we looked at individual somatic cell count data, and all cows over 150,000 got tested throughout the year. So in the first herd test, there were 186 cows over 150,000 at that stage, and 117 were positive for Prototheca. And going through that process that I've just described, we ended up with a total of 259 cows out of that approximately 700 with Prototheca. So as I said, the economics were quite different for this farm. The share milker was just not prepared to take the hit financially, just to get rid of all those cows at the start of a season. So we took the option of separating these cows into an infected herd, which was milked last, focused on good teat spraying, and hot acid alkali wash, so making sure the plant was clean between milkings. So it was a risk. We weren't sure what was going to happen over that season, having two herds on the farm, one infected, one non-infected. But a lot of sleepless nights, but we got to the end of the season, and we tested all 412 cows that hadn't been tested prior, because they hadn't come up as significant in the protocols that I've outlined, and only 6 were positive. So that was, I guess, from the farm manager, or the share milker's point of view, and from our point of view, it showed us that yes, it was the right move for him. So what was the economic loss? Well, he started off with 697 cows, and as I said, 259 of these were positive for Prototheca, and were therefore they were culled at the end of the year. So in New Zealand, our replacement rate is around 1,500 New Zealand dollars. So for him, he lost $400,000 of his asset as a share milker, which he then had to replace. But if there is a positive, it's a very stressful situation for the farmer. The total season production was only 3% down, so there was a much lower loss from that season by keeping these cows on the farm. So in New Zealand, we're paid on milk solids rather than litres, so fat and protein combination, and we just doing the maths on the production that those cows would have, milk they would have produced for that season, times our payout on milk solids, $575,000 is what those cows were worth to keep them in the system for that year. And yes, there's a huge reduction in the bulk milk somatic cell count, which I guess is what we'd expect, having taken, well, as we went through this process, we had some, so I should back up, so a lot of these cows were still milked over that year, so, and this is the year that both herds were still milked. In case you may ask the question, Prototheca is killed by pasteurisation, so it was still okay to send this milk to the factory to be processed. So this year here is where both herds were still in there, and then we culled the 259 Prototheca positive cows at the end of that season and got that drop in bulk cell count. So the conclusion from this case study was that yes, there was a risk of keeping Prototheca positive cows on a farm, but in this situation we managed it as best we could, and it was the right decision for this farm. And so having kept all those Prototheca negative cows in the main herd, and the fact that we only had 6 positive at the end of that season just showed us that yes, there is this risk of fecal or milk spread, but by keeping the 2 herds separate, that we managed that as well as we could, and economically and for the farmer's point of view, it was the right decision. I guess we were concerned about fecal spread. Now I said this is pasture-based, but at the end of the day, the 2 herds were managed on the farm, so both herds move around the farm, which would be quite a different scenario from when you're a stall-based system where cows are obviously going to be in much closer contact than we are in New Zealand. Right, that is me.
Great. Thank you very much.